All right, looks like we're right at 12 p.m. EDT. So welcome everyone. My name is Chiquita D'Souza. I'm one of the education chairs of the American Academy of Pediatrics section on Global Health Executive Committee. I'm pleased to introduce this AAP webinar series, Global Health Practice in the Time of COVID, Finding Effectiveness in Your Personal and Professional World. Our second webinar in this series, the Women in Global Health and Parenting During a Pandemic, when the Venn diagram of work and family collapses, will begin shortly, and it's co-hosted by the section on Global Health and Popcorn Network. The presentation will begin with each panelist going around, and then we'll follow it by Q&A. Please submit any questions that you have. You can feel free to do that throughout the presentation, and just make sure that it's addressed to all panelists, not just private messages, so that we are able to see it and won't miss those. I also would like to mention that we have no conflicts of interest to disclose. And without further ado, I will hand over to Dr. Hack, who will be moderating this session and will introduce all our panelists. She's our section's education chair for NCE activities. Oh, and right before that, just wanted to mention the next two webinars in the series. Please save the date for the following webinars: Supporting Healthcare Workers Here, There, and Everywhere, which will feature practitioners in different countries and also in the US doing global health work. And then also one on health disparities locally and globally. So please make a note of those dates. We'll put this slide back at the end of the presentation so you can also take note then. All right, over to you, Heather.
Okay, thank you, Dr. D'Souza. Good morning, good afternoon. My name is Dr. Heather Hawk. I'm the Chief Medical Officer for the Baylor International Pediatric AIDS Initiative, BPI, and also serve as the Education Chair for the AAP section on Global Health. I'm thrilled to be here today to moderate this discussion on women in global health and juggling parenting during a pandemic. We've got some stellar presenters today who I'll be introducing shortly. But first, I wanted to just frame our discussion a little bit. And first, I wanted to say, well, our panelists bring experience from the fields of global health, including local global health and serving domestic underserved populations. This discussion and the resources shared today will have implications beyond this field of practice. So even if you are not working in the global health sphere, this discussion will have relevance to you as well. So women make up 70% of the global health workforce, and it's vitally important that we examine how COVID may be impacting women leaders specifically. Familiar to many of us is the great juggling act of balancing our multiple roles as women, mothers, physician leaders, academics, and global health practitioners. This juggling act is challenging in non-pandemic times, and we know that there are many barriers to women's advancement in leadership, even in non-pandemic times. Add COVID to the mix, and the juggling act becomes more difficult, amplifying existing gender disparities. Of course, the COVID pandemic brought with it not only shifts in our professional responsibilities to prepare for and respond to the pandemic, but also brought unprecedented disruption to schools and daycares, with much of the childcare burden falling on the shoulders of women. It's not a term that I love, but some have proposed the term pink collar recession to describe the disproportionate impact of COVID on female professionals. In academia, we're already seeing indications of the toll of this pandemic on women, with the percent of journal submissions decreasing among women authors. And we're finding that women's publishing rate has fallen relative to men's amidst the pandemic. One study conducted last month in May 2020 compared the authorship of 1,100 medical COVID-19 papers with 37,000 papers from the same journal in 2019. This study found that women's share of overall first and last authorship in the COVID papers decreased by 16%, 23%, and 16% respectively. So we're already seeing indications that women are not publishing as much during this time. Myself, as a physician leader, a global health practitioner, a hospitalist, and also a single mother, I can attest that this struggle is real. Layered on top of and intertwined with the pandemic is the acute and chronic racial trauma that our country is navigating now as well. This picture with my daughter captures me navigating this world as a mother, as a physician, as a child health advocate. And this was a protest, a rally that we attended in Houston, White Coats for Black Lives. So without further ado, I'd now like to introduce our first panelist as we start this discussion. So Dr. Rachel Peterson is an assistant professor of clinical medicine and clinical pediatrics at Indiana University School of Medicine, and is also the communications team co-lead for Popcorn. Dr. Peterson, over to you.
Hi, thank you so much, Dr. Heck. I'm really honored and humbled to be a part of this group of women talking about how this has affected us all. So I'll just talk a little bit about who I am. So like Dr. Heck said, I'm Rachel Peterson. I am a med-peds hospitalist at Indiana University, which is located in the Midwest in the United States. I am a professor, so I work in academic medicine, and then I have special interest in the care of adults with conditions of childhood, specifically inpatient hospitalized management of these of this population, as well as the transition of these patients to the adult care side. So I'm also the mother of a 4.5-year-old and a 1.5-year-old little girl, and I am expecting our third little girl in October, which is very fun and obviously nerve-wracking. So in terms of challenges, I'll share a little bit about my story. As we saw the search, and I'm sorry, I think my slide's going back, but I'm not touching anything to do that. But these are the two slides that you can focus on during my talk. So I apologize if that's giving anyone a headache. I'm not touching anything. So at the start of the COVID surge in my area, I was still in the middle of my first trimester of pregnancy. At the same time, my parents, who I'm very privileged to have provide child care for myself and my husband, my dad started to have symptoms of COVID and had to isolate, from my family just for health reasons. And then I also found that my normal support community was ripped away. I'm a very extroverted person. I'm very social. I like to connect to others. And all of a sudden, we were all told to go home and Zoom from our offices and not see patients in person. And so I found that that was a large part of my social connectedness, and that shifted drastically. So I had a bunch of things to consider. I had my own personal health and my baby's health. I was told by my obstetrician that I was not to care for COVID patients if possible. I also had to consider my parents' health, and while I have siblings, I'm kind of the primary support for them as well. And then without childcare, I had to think about how to take care of my kids while working and supporting my family still, as I'm the primary breadwinner for our family. So it all kind of came to a head all at once. And I know I mentioned I'm interested in the inpatient care of adults with conditions of childhood, but I also have interest in communication, as well as some specialized training in that. And so as our area surged, the palliative care team at our adult hospital found that their census increased 3 times its normal size. And so I was redeployed to palliative care, which is not my normal area of expertise. It was a blessing as well as a hurdle to kind of think about, since I don't do that normally, and obviously there's a lot of emotional load with that as well. I've been thinking through these solutions and why I feel like this has maybe been a huge juggling act, and I'm sure I've dropped balls along the way, but I also feel better connected after, as we've kind of come through my area surge, and I hope that the things that I've learned will help. So in front of you is the individual wellness scale, and it kind of talks about all areas of our life. Thinking about my own wellness started a while ago when I had a mentor commit suicide, and it really made me think about trying to balance that all for myself. So thinking about these areas of my life, I bolstered these before COVID came. But then when the surge hit, I also realized that connecting is probably the best way to engage in caring for myself as well as others. As mentioned, the Popcorn Network, which is the Pediatric Overflow Planning and Contingency Response Network, was formed in March. And a friend of mine, Dr. Ashley Jenkins, reached out to me and said, hey, do you want to join us? As a med-peds doctor, this felt like something that my skill set could answer. Similarly, when the palliative care doctors at my county hospital reached out, it felt like a way I could give back. While it wasn't how I probably normally would have seen my response, I was happy to be able to help in whatever way possible. The other thing that was really helpful, and I want to make sure I share, I'll share in the comments when my part is done, is that I've been thinking a lot about growth mindset, and hopefully many of you have heard about Carol Dweck and her book on growth mindset, but I think I wouldn't recommend reading it during a pandemic. I think my reading has gone by the wayside. But I did take from her book the fact that we are adaptable. And so that is just something a mantra I said to myself as anytime I felt that stress hit and the cognitive and emotional loads rise, I would just take a deep breath and tell myself that I am adaptable. And none of this was done perfectly. While I engaged with the Popcorn Network, creating educational materials for pediatricians to care for adults. Many members of the Popcorn Network also know that my 4-year-old was in the background watching Daniel Tiger on my iPhone. And we don't really do screen time, or we didn't do screen time much before this pandemic hit. So, I've learned a lot about having grace with myself and grace with my family. And grace with others. And I'm hoping that this, I was thinking, I don't know how we all would have done this 10 years ago without the connectedness that we have today. But I also think that, and I hope that for women that this has opened opportunities for us to be more flexible and integrate our work and our lives together, that it's okay if my 4-year-old hops on a meeting with me with the CMO of my children's hospital, and she can see that sometimes I'm going to turn off my screen when my 4-year-old throws a fit. So I hope that we, as women, maybe we've experienced a bit of a setback, but hopefully we can see some growth as we move forward. So thank you. Back to you, Dr.
Sure. Thank you so much, Dr. Peterson, and thank you for your work with the Popcorn Network. It's becoming relevant right now here in Houston as we're entering a surge and our children's hospital is preparing to take care of adult patients. So thank you for all your work and innovation there amidst juggling parenting responsibilities. So thank you so much. I'd like to now transition over to Dr. Emmy Connolly. Dr. Connolly is Malawi Chief Medical Officer for Partners in Health and also an assistant professor of hospital medicine at Cincinnati Children's. And we're very pleased to have her here today. Thank you, Dr. Connolly.
Thank you so much, Dr. Hack, and likewise to Rachel. I'm so honored to be part of this panel of amazing women. And I know there are many more amazing women that are attending, and that we could have such wonderful conversations for all of us if we had hours upon end of all the different challenges that we've gone through in our lives, and then also most recently in the past few months. I just wanted to share just a little bit of my background as well with you, and then just jump into some of the challenges that I've experienced and some of the solutions and coping that I've found to be helpful, but I'm also learning from everyone else on this call and continue to learn. The majority of my life, I work in Neno, Malawi, it's a rural southwestern district in Malawi, which is in southeastern Africa. And then a small portion, I still work as a pediatric hospitalist at the Cincinnati Children's Hospital and Medical Center, which I'm actually here right now on service doing that part. And then, of course, my other large role is that I have twin 6-year-olds who are almost to be 7, which they're very excited about, and have another one on the way, similar to Rachel, and congratulations. You know, I think just how we kind of got to this place in my story with that is unfortunately due to some insurance concerns and also travel restrictions in between countries, and due to pregnancy, I was asked to return to the United States from the position in Malawi, and that was very challenging, I think, for myself in terms of feeling that I was leaving the team, and that this was a time that I really wanted to be there and to be working. And I know that rings true for a lot of us, whether that is in the hospital, seeing our patients ourselves, not doing telehealth visits, not doing tele meetings. And I think that's been one of the hardest things for me to work through. I think that disconnection between patients, my community, the people that I work with on a daily process, without that interaction with people has really been the biggest challenge for me, which I hear strongly from Rachel, and I'm sure resonates strongly for all of us. I think also being away from, even though I'm a visitor in Malawi, my home, and really the place where my sons have lived most of their life, and their friends are there in their school, and now they're old enough to say, I am really missing home and school, and that's been very challenging. I think also then to that point, you know, especially with returning to the United States, we haven't had one place where we're staying, and so we've been moving in between places, and also trying to manage some schoolwork for my sons and other responsibilities while working from home, and similar, you know, mess ups of where I wasn't on mute and yelling at my sons in the background during important meetings has also been a challenge I'm sure all of us have gone through. And then, of course, time management. It's so much harder to communicate on Zoom and Teams and Skype, and trying to just make sure that the schedules align, especially when we have, you know, time zone differences and lots of emails, and the social distancing aspects have all been really large challenges for me. I think some of the solutions and coping mechanisms for myself, and what has really been helpful, is really thinking, I get angry at this word sometimes, but really thinking about resilience, and sort of going back to Dr. Peterson's mention of adaptability. You know, how do we think about this new challenge and the new situation and give ourselves some room to grow and have that grace, you know, to grow in different ways that we thought, you know, it was never going to be acceptable for my kids to be on a meeting with me, but perhaps now it is. And I think for myself, you know, ways that have really helped me with coping around this is really thinking a lot about what things I can't change and what things that I have power over, and then focusing energy on those. But then even more so is what can I really work out in my life that I can also say no to, and really focus on those meaningful opportunities that have a lot of purpose and mission in my life. And the more that I can move out and focus on the people that I care about and the people that I work with and the people that are working so hard in this pandemic to combat a lot of frustrations that are travel restrictions and misunderstandings and, you know, all of these different things we're learning about humanity in terms of how difficult it is to social distance and wear masks and be detached from people that you love and care for and work with. And how can I really focus on them and all the work that we're doing together, and really try to make, I guess, a new sense of community, even if it's only talking, you know, via a computer. I think I've been on service for about a week now, and the ability to see patients in the hospital and work with some of the residents, I didn't realize how much I needed that. And it's really been a wonderful pause. And so I think moving forward with continued requirements of this kind is really seeing how I can get a little bit more of that too, or how can I sort of have informal conversations, or really just catching up with people instead of it always being business and meetings. And so really sort of building out that community and that, you know, social support that's so much easier when you're just in the office or in the hospital and you can just find someone in the hall and chat with them. So I think around a lot of those, you know, I do come back to that question, you know, of resilience and how can I adapt and how can I find the ways to move forward. I don't want to pretend that it's easier. I have the answers or anything, but I think that having forums like this, that we can talk about it and that we can really put out our challenges and different solutions together, hopefully will continue to move us, you know, in the direction that we've been going and that continue to work on. You know, some really key resources for me have been making sure that I keep others knowing that they're appreciated and that I really value their support and their work and everything that they're doing. I think supporting other causes and challenges that have come up, such as domestic violence, homelessness, racial injustice, you know, within that are really highlighted by this pandemic, has also been really helpful for me to sort of reach out to those and see how I can make a little bit of a community that way for myself as well. I think the AMA and the AAP have got a lot of wonderful resources as well. And then for anyone who's in the United States, Headspace allows you to use this application for free and has some really nice calming music that's great to fall asleep to or meditate, and they can walk you through that. So I'll end there so my other panelists have time, but I look forward to the discussion.
Okay, thank you so much, Dr. Connolly, and I really appreciate you sharing your perspective that's kind of unique to some of us working in global health who not only are juggling all of these dual responsibilities, but also were uprooted from your home in Malawi and feeling conflicted about not being there on the ground to support your colleagues. So next, we're going to transition over. It's my pleasure to introduce Dr. Salaminish Sige, who is a consultant pediatrician, assistant professor of pediatrics and child health at the School of Medicine in Addis Ababa, Ethiopia, and also working at the Gojo Accommodation and Temporary Shelter for Patients in Need. So Dr. Sige, over to you.
Thank you, Heather. I'm really honored to be chosen as a panelist in this discussion. My deepest gratitude to the American Academy of Pediatrics, and I'm really glad to meet all these great women on this panel discussion. So I will start with a little summary about the major key challenges that women physicians may face. These are the common challenges. So as Heather said in the introduction, women carry out far more care work than men, up to 10 times as much. These are reports from the OECD. And during a pandemic crisis, violence, exploitation, abuse, or harassment against women increase. And we are hearing a lot of violence in our setups, violence against women, violence against children. And the women have more professional responsibilities. They are more involved in the health care taking, though they are less involved in the leadership. Women are more affected by this pandemic, and the women's role as unpaid worker at home is the greatest item that poses great challenge to women. So when people are confined or when they are forced to cohabitate in one place, so these things, the ones that I mentioned, like violence, will increase. So when we go to my story, as Heather said, I am a pediatrician at the Major Tertiary Hospital in Addis Ababa. And this is the hospital picture that you are seeing. And this is from the International Developmental Pediatric Association Conference in 2019. So in Ethiopia, we don't have a developmental pediatrician. So I am planning to become the first developmental pediatrician in Ethiopia, and I am working in that line. So now, since my graduation as a pediatrician for the past 1 year, I have established the first developmental clinic in our hospital, and I am working with children with disability. Since there is no senior above me with this subject, I had to teach myself, and I was learning through different resources, mainly from the resources from American Academy of Pediatrics, with some of my mentors residing there. And I am trying to practice the best possible care for children with disability. And since the first report of COVID in our country, which was in March 2020, this clinic has become somewhat, it's difficult to call it virtual, but it became like a teleclinic. So we have to call and meet our patients, and then we have to decide what is going to be done for this patient. So as you know, children with disability, they have many needs, and those needs cannot be met with a phone call. So it was necessary to see this children in our clinic, but that was not possible after this pandemic. So I was monitoring this clinic from home. I received clinic reports from my residents, and I received phone calls from my patients, and also I have most of the phone numbers of my patients, so I call and check up on them. And with regard to my engagement with children with disability, I did research on cerebral palsy, and this is a grant which was prized to me by the Queen of Sweden that you are seeing here. And the other affiliation that I have is with, I established a temporary shelter for patients who come from the remote areas to our hospital. So the main referral hospitals are in Addis Ababa, which is the main city. And these patients, they come referred with different kinds of chronic illnesses, and most of them, they need frequent follow-up, and majority are oncology or patients with cancer. So these patients, when they come here, they finish their money and they have no money for food, so they beg for money to feed themselves and the one that they are caring for, and they beg for transportation fees. And if they are not able to meet these things, we find most of them lying on the streets. So this shelter gives service for these patients. So we accommodate these homeless patients. They are not homeless, they have home in their country, but because they are referred to the main city and they know nobody here, they became homeless when they arrive in the city. So we provide temporary shelter to this to this set of patients, and we feed them. And when they finish their clinic follow-up, we send them back home, covering their transportation fee. So this is the shelter that we built for these patients, and this is the dining hall. These are the bedrooms. And so this picture shows you the contrast what happened after the COVID pandemic. So here you see all patients, they are eating together. And so this social interaction is very important in our society, because this is how they cope with their illness. But now we have to keep the social distancing, and we have to decrease the number of patients that we are admitting to this shelter. So when we see the challenge with respect to these patients, the challenge is more severe in women, because when they are not admitted to a shelter like this, they have to stay by the streets, and they are more exposed to assault. So this is one of the challenges that this pandemic posed. So this is the prize that I was chosen as Ethiopian 2019 Woman of Excellence for the work I have done with Gojo. And here you see a mother caring for her child. So this child, I have consents for the pictures that I'm using, so don't worry. So this child is a patient residing in Gojo, and this is his mom. So when you see the patients that come to our shelter or in the hospital, either a mother or a wife is accompanying them. So most of the time, women are known for the elderly cares, for child care. And so this is an additional challenge which we are all facing. And so I just wanted to mention what's happening with respect to the patients also. So with my story, I am a mother of 2 children, and this is my older daughter. She's 3 years old, and this one is the newcomer who was born actually in February 2020, and he's now 3 months old. And so I am working from home now. I engage on monitoring my clinic and teaching my residents, and on patient calling, and I have to engage in different sessions like eco-autism and OMID sessions to teach myself on how to further up my clinic. And I am also engaged with the emergency operation committee of our hospital regarding the current COVID situation. So these works, I have to do them from my work and from my home. And there is a regular sessions like from my department that I have to participate in teaching sessions. And there are a lot of webinar series. I am sure all of you are facing this. You get invitation from different places. And so I have to do all this from my home, and I have to meet the needs of these 2 children. So that is the greatest challenge I have. And actually, I am on a maternity leave currently. And 2 weeks after my delivery, the first case of COVID was reported in our country. And I am, as I told you, monitoring everything from home. And so my greatest fear comes now that I have to leave my little son and go back to work, because my maternity leave will end in 2 weeks' time from now. So that was my greatest challenge until 3 days back, when I found out that the WHO allows 6 months maternity leave, and the state of emergency in our setup also allows 6 months maternity leave. So now I think I resolved that challenge with the current state of emergency law. And the other greatest responsibility I have is I have to make sure that the patients residing in the shelter, they do not contract COVID while going back and forth from the hospital. So I had to do a lot of work to secure secure sustainable preventive equipment for these patients. So these are some of the stakeholders who are helping us. So I have to write different grants to different stakeholders and secure PPE for these patients. So then thank God I have managed to secure for now, but I have to continue working on that. Okay, so this picture shows more or less my life. So here I usually work from, I usually attend webinar sessions and teach my residents from home. And I have to send regular assignments to residents after teaching in my clinic, because that's how I should teach them, because it's a new clinic. And so my children are always around me when I do everything. So most of the webinar session, I look like this woman here. So I hold my baby and my daughter is beside me. So when we talk about time management, one thing I tell you honestly is time management is easier when you are going out and working. It's very difficult to manage the time from home, because you cannot limit the need of your children, and you have to deal with whatever they are asking. So what's working for me is taking a break. So when do I take a break? I take a break when my children sleep. So they sleep early, thank God. So by that time, I give myself some time to have fun. So I read whatever I want to read, or I watch movies, or do something that gives me a break. These are some of the resources which helps children to understand the current situation. I like this book by the WHO, My Hero Is You, and this is another book from England. It's a book which teaches children about coronavirus. So children ask a lot of questions. So these are important resources that I want to share with you. And so you may, about physician wellness and resilience, I think Emilia did a good job explaining that, so I don't want to repeat what she already said, but my conclusion is take a break. So this is my little boy. He sure looks that he's having a break. So stick to your routines, and you have to move around, and you have to always remember to reach out to others whenever you are feeling stressed, and you have to. So for me, what works is I move with the grace through blow-ups, because as I said, with cohabilitation, there are you will face so many blow-ups, and please remember that this is temporary, so it will pass. So that is my message to you. Thank you. Back to you, Heather.
Okay, thank you so much, Dr. Zige, for joining us all the way from Addis Ababa and during your maternity leave, no less. Congratulations on the birth of your son. He's beautiful. And thank you so much for sharing about how you are juggling all of this during what sounds like a very busy maternity leave, caring for your patients, managing the NGO work you do, and also being a mother to 2 children, including a newborn. Quite a lot that you're handling, and we really appreciate your words of wisdom. So thank you. And next, we're going to transition to Dr. Kadira Huff, who is a attending pediatrician at Children's National Hospital, and also a lifestyle medicine physician and founder of Sprouting Wellness. Dr. Huff.
Perfect. Thank you all so much for the opportunity to be here to speak with you all and to share a little bit about my story. at this point in time, there have been a few very strong themes that have emerged in terms of the importance of showing ourselves grace, the importance of flexibility and adaptability. And so I'll definitely be building on a lot of those same themes in my own story. But before I jump in, a little bit about me. So I'm a general primary care pediatrician here in Washington, D.C. As a part of Children's National, and I work in a predominantly low-income, underserved area, predominantly African-American. And right around the time that COVID rolled out and clinical practice changed as we had known it up until that time, I had been just about to launch a new business venture. And so the name of the game for me has been really trying to dig deep and to become more nimble and flexible, which are kind of challenging traits to develop on the fly when we're really used to planning and having timelines and goals. And something that has become very, very clear is that we are really not in as much control as we might hope or think we are. So I think just kind of from a bird's eye view, for me, the three biggest buckets of challenges have been, one, the professional bucket, thinking about really the emotional toll of practicing in a historically underserved and low-income area in DC, especially as the health disparities and the differential rates of illness and mortality have begun to roll out, and thinking about the social determinants of health in which many of my patients live and work, and how that was particularly hard to be in the midst as a Black woman doctor, to stay abreast of all the rapidly changing clinical workflows and practices and guidelines. And that felt like a part-time job in and of itself very often. Getting nimble in terms of the practice of telemedicine and figuring out the best ways to approach clinical care in this totally new way. And then the baseline worry in the back of my mind about the potential for job security loss. There have definitely been many discussions online and physician forums about physician furloughs, for instance. And so that was something in the back of my mind, too, that has been a source of worry and kind of stress as we navigate the clinical realm and implications of COVID and the impact on a hospital system. So for me, the second big bucket, which is a little bit different from many of my other co-panelists, was this entrepreneurial or business bucket. So the timing of the pandemic, the start of the pandemic, coincided with a long ago made plans to reduce my FTE with children so that I could more proactively ramp up this business venture. And so the business venture is to develop a virtual lifestyle medicine practice that essentially helps to bring families from information to implementation around adoption of healthy habits, which many of us know is very, very challenging in the primary care context, or really the traditional healthcare context in general, where we're limited by time and continuity. But just 4 weeks after my FTE changed, the pandemic hit and daycares closed. And so that kind of coincidence has been probably the most challenging to make peace with, in terms of all of the best made plans really kind of going up in smoke, and really being forced to reassess what my goals are at this moment and what is most needed in terms of priority of time at this particular moment. And then the third bucket for me has been obviously the personal piece, like juggling motherhood duties with daycare being closed. I'm the mom of a beautiful, very active, almost 3-year-old who has been delighted to be home with me during the last 3 going on 4 months, but it's definitely posed some very real challenges in terms of balancing clinical work with the business startup, and also carving out time for my own well-being. And that's something that I try to take pretty seriously as a lifestyle medicine doctor as well, is, being okay with carving out time for myself and realizing that we, especially as women, cannot pour from an empty cup. And so really trying to prioritize my my personal self-care habits, which I'll go into more detail later on. But really, I think overall, like, as I've tried to navigate these 3 buckets, the clinical, the business, and the personal, it's really trying to reinstate the idea that we have to have abundant grace for ourselves. And I think each of my previous co-panelists have used the word grace because it is super critical right now. And also being comfortable with a little bit of messiness and discomfort. and let those kind of factors be the starting stone to more personal growth. And I love the discussion about growth mindset. I think that is so key. And I really think that that's the secret sauce in terms of coming out of this a little bit stronger, a little bit more mental fortitude, and also a little bit more flexible, because really that's what's most essential at this moment. Before I move on to talking a little bit about some solutions that have been helpful for me, I wanted to talk a bit about the emotional toll of practicing in my particular context of a low-income, primarily Black neighborhood in DC. So we've all seen the statistics and the headlines in terms of Black and Brown communities being hit the hardest by COVID for a myriad of reasons, but many of those reasons really trace back to the social determinants of health. And so seeing many of my patients make really real decisions between employment versus keeping their families safe by staying home, an almost impossible thing to ask families to do, where parents are feeling compelled to show up to jobs where there is definitely an occupational hazard of exposure because they need to have money to put food on the table for their children. And also thinking about children who have fallen behind academically, who are already quite vulnerable and at high risk of poor academic performance and graduation, and having that be connected to some of the digital divide issues that we see, where families of fewer means don't have the high-speed internet, they don't have the tablets and laptops, and even the infrastructure within homes to set children up for success in terms of completing schoolwork. So that was another huge issue. And the last social issue that has been really difficult to navigate has been the food insecurity component of the COVID pandemic in my patient community, where the schools have been the safety net for many, many children in terms of ensuring they at least get a breakfast and a snack and a lunch, and at some schools even dinner, and having that kind of pulled out from under many families. And while there have been, for sure, alternative programs and some schools have remained open to be food service sites, that's definitely been hard for many, many families. And so it has been challenging to be, at one hand, like a member of the community in terms of I'm a Black woman physician practicing in this community, and feeling a little bit of guilt about my own sense of privilege as I come in, and also being a little bit, I guess, uncomfortable with complaining about my own personal and unique challenges. And so I've had to do a lot of conscious work to say, this is not comparative misery here. Like, everybody has their own unique challenges, and my challenges are no more or less important than anybody else's. And it's really about what you do to move forward, and using the challenges as a springboard to moving forward in whatever way that makes sense for you. And so the theme of guilt has definitely been something that I've proactively tried to manage, where it's kind of, you're darned if you do, you're darned if you don't. It's been fascinating because I did have the privilege of a little bit more time, having reduced my FTE, even though that change had been for business, but then it ended up being used more so for care of my daughter. But then feeling guilty, oh, this is not what I'm supposed to be doing. You know, I'm supposed to be home working on this business. I'm not supposed to be full-time momming when I have the free time. And also thinking about, you know, the little nagging voice in the mind in terms of academia, like I'm not being productive. But you know what, at this moment in time, what I have the ability to do is show up as a mom, show up as a doctor, and realize that there's going to be kind of moving targets of priorities at different times. And so kind of shifting gears into solutions, I think the turning point for me, as I've been trying to internalize all the different buckets of challenges, has been to utilize the employee assistance program through my hospital. That was actually a really fantastic move in terms of essentially getting a few coaching sessions to shift my perspective from, you know, resisting circumstances as they are, seeing them for what they are, and kind of moving from there. And so that really helped to get me out of the funk of kind of reeling from this new way of living. And so I definitely want to plug that service for everyone. It's a free service for employees of, I'm sure, all of our major health institutions. And it's a wonderful way to kind of just like reset and have a fresh set of eyes, and having an external individual raise a mirror up to you in terms of what you do have power to do and how you can kind of shift your perspective. So in tandem with the EAP sessions, I really started to double down on my Wellness Toolkit is what I call it. And these are tools that I have really honed as a lifestyle medicine doctor. This is what I'm hoping to deliver to the masses. And so having that kind of pre-established set of tools that help me with my personal wellness, I really dug deep to rededicate myself, carve out the time for setting a bedtime, right? I think our routines have all kind of like gone up in smoke in various ways, some smaller than other ways, but having a bedtime for myself that I could ensure to wake up before my daughter so I could get my meditation in. I'm not like a perfect everyday meditator, but I try to get it in most days. And I find that the days that I do it, I show up much better in all the different roles and responsibilities that I have. Really integrating my regular movement and not feeling guilty about having the time. I was fortunate enough to get a Peloton like the month before the shutdowns happened. And so that was the best kind of serendipitous moment to have that resource at home to stay active. Journaling, that's a really quick down and dirty tool that many of us can use to get our stresses out really, really quickly. And then also thinking about a very loose gratitude practice, which is not something that should be hollow, but really just it helps to shift your perspective into more of an abundance mentality in terms of not focusing on what is lacking, what is missing, what could be better, but focusing your attention on what you do have. And that's a very quick and powerful tool to just shift your whole energy and your approach to the challenges before you. So my biggest call to action is to really think about your own wellness toolkit. What are those like key habits that you know help to boost your mood, to give you more energy, to make you feel a little bit more grounded, and really focus on just like 1 or 2 actionable steps per day. And really like knowing that this is a lifelong journey, and having those honed tools kind of as a daily routine help you to be quote unquote more resilient when times get really hard. It took me a few weeks to really kind of get out of the funk and to recommit to my wellness toolkit, but I know it would have taken me a lot longer if I didn't have those pre-established habits to fall back on during this time of chaos. So some of my favorite resources before I pass the baton are the Art of Living Foundation is a really wonderful org that my hospital actually brought in to do some meditation training. And so they've offered this in the context of physician wellness at our hospital, and it's been a totally free training, but they offer it for not just healthcare workers. But check it out online. They are offering virtual trainings, and it's a wonderful, pretty quick and easy daily practice that you can establish. Also, I already plugged the Employee Assistance Program at your home institution, and also the meditation apps that I know have been previously mentioned has a free subscription for healthcare workers. Also, Insight Timer has a lot of free content, Happify, Calm. Find something that is easy and free and just try to do it for 5 minutes a day, and you will see the difference. All right, back to you, Heather.
Okay, thank you so much, Dr. Huff. I really appreciate you sharing perspective of caring for an underserved community and communities of color, and some of the special considerations and challenges and lessons that you've learned there. I also really love the concept of a wellness toolkit and everybody building their own wellness toolkit. That's something I personally am going to take from this talk. So we have just a few moments for questions. Anyone who has one, feel free to type it in the chat box. Otherwise, I was going to get started with a question. We've heard from 4 remarkable women who are working in diverse areas of medicine and public health and global health leadership, and juggling parenting children from newborns through school age. And we've heard some wonderful themes around adaptability, resilience, maintaining a growth mindset, practicing gratitude, and practicing grace. So thank you for all of that. I did want to ask, and this question is for anybody, why are the voices of women important during this time, during the pandemic? Why are our voices important? Why are our scientific contributions important? Why is our leadership important during this time? Who would like to take a stab at that?
So I'll go ahead and take a stab. I think that our voices are important because we are still so far from where we can be. When I think about, I feel so privileged when I hear stories from my mentors who trained 20, 30 years ago and the uphill battles they had to fight. But the truth is that we aren't in a place where equity is present across the board, right? We see that women physicians are paid less, that we fill fewer department chair and division chair positions in academic medicine compared to how many there are of us. I even saw a paper before COVID that showed that something like 40% of women leave academic medicine before they hit year 6. So I think our voices must be heard, and I especially think about that when I think about my own children. My daughter is like, I want to be a doctor so I can work with you, Mom. And I hope that one day, if she chooses to be a physician, she does that because she loves patients and loves giving of herself and caring for them like I do. But I also think that I hope that academic medicine is such a more welcoming world when she's in the position I'm in. So.
Thank you, Dr. Peterson. So let's try to get in a few more questions with brief responses. So we have a question about how can we support our female colleagues during this time? And this includes maybe how do men support female colleagues during this time?
So I'll go ahead and say a few things about this. Am I audible, Heather? Are you hearing?
Yes, I hear you. Please go ahead.
Okay. So as we have been saying, the men can help women as there is a high unpaid workload on women that we know of. So especially this has been like a tradition even before the pandemic. So when the schools are closed and when children are at home, so the responsibility of the woman will be very high and will be very stressful. So men can help by sharing some of these responsibilities and by being there when the woman wants to breathe out the stress that she's feeling, and mainly they can do small things, but that really matters, like feeding the baby really matters for the mother, because that is one of the works that she has to do, or bathing the baby, that really is a great help for the mother. So we don't have to think of great helps, but there are small things that they can help with while staying in the home.
Thank you, Dr. Sige. I totally agree that sharing those domestic responsibilities that often fall disproportionately on the shoulders of women is really important. And what about in the professional realm? How might men be able to help their colleagues?
I think, so as we said, the women share the higher percentage of participating in the healthcare work. They are minorly represented in the leadership state. So men should encourage women to go up to this leadership state. And so we have to identify what is the reason behind that women are not courageous, are not showing enough courage to go up to the leadership positions. So I think these things has to be identified, and if our main colleagues become more supportive in our profession, I think that can be good.
Thank you, Dr. Sige. And Unfortunately, we're out of time. There was another question about handling childcare. I'd just like to acknowledge that that's a struggle for all of us, and I think everybody is finding different solutions to make that work. So I want to thank everybody again for joining us today. This was a fantastic discussion, especially thankful for our panelists and our AAP colleagues for arranging this. And I've really enjoyed moderating the session. I'm delighted to share that we'll have additional webinars related to COVID, and we hope that you will join us. The next one is on July 2nd at the same time on supporting healthcare workers here, there, and everywhere. We'll have a great panel of speakers from different organizations working across the globe talking about how they're supporting their health workers. And then we have a session on July 14th on addressing health disparities both locally and globally, which we have found to be vitally important during this pandemic. So we hope that you'll continue to engage with our AAP Global COVID series over the summer months. And thank you all so much for attending. Have a great day.